Congressman Massa, thanks again for coming tonight. Everybody wants lower cost. Everybody wants universal coverage. Everybody wants better quality. And we've heard a lot of people ask questions tonight, very specific on everything from abortion to copay. Maybe you can kind of summarize here while we get bit by mosquitoes. What your overarching foundation and plan is if you were going to write the bill from scratch. We heard single payer program, we heard tort reform. What are the key tenets of it?
So let me take the question, what are the key tenets? I happen to believe that if we cannot reach a national consensus on comprehensive health care reform, there are a lot of things that we can do that almost everybody will agree. And we can do them individually. We can abolish the donut hole in Medicare Part D. That we can do. We can force prescription drug companies to competitively bid for access to Medicare. I think a lot of us would agree with that. We can take approximately $1.3 billion in cost out of the system by going back to the good old days when prescription drug companies didn't advertise prescription drugs on TV. Now, by the way, I know that butts up against...
Some questions. You're not here to give a speech, sir.
Well, So the question was, what do I think we ought to do in healthcare? And I'm trying to kind of enumerate those things I think we ought to do in healthcare.
You're doing a great job.
These are specifics that I think we can do. I apologize if it comes off as a speech. I don't know how else to do it. So there are things, very specific things, that can be done. We can find a way, specifically, through either a do no harm or a Samaritan law that protects especially the high-risk medical practitioners from frivolous medical malpractice suits. We can do that. Many have figured out a way to do that. By the way, we do that in many of our states, in the majority of our states. We do that with emergency medical technicians and paramedics. I'm an old EMT. I was covered under a Good Samaritan law. If I acted under the education and codes and training that I received and was certified for and had a bad outcome, I could not be sued because I was doing the best I could do. Right. And that's potentially another thing. So there are a laundry list of potential specific pieces of legislation that we can attack. I hope that answers your question.